with Gretel Wardak and Michaelin Bichel. Today we're talking to the AVMA President-Elect, Dr. Jen Quammen. She started off getting her bachelor's degree in biology and mathematics from Northern Kentucky University, then a master's of public health from the University of Iowa, followed by her DVM from The Ohio State University. So she's also worked as a veterinary technician and the Chief Veterinary Officer at Auto, a veterinary tech platform designed to help clinics streamline communications and workflows. She's also co-founded Veterinarian Coaching, and we are so happy to have her here.
Yeah, so today we're kind of going to talk about everything tech and just have a casual chit chat. I would like to hear about what we were talking about previous to recording. As we know, Gretel and I are both in vet school, and a lot of our listeners are in vet school. Could you tell us a little bit about your experience working as a tech during vet school and how that was?
Yeah, sure. Happy to, and super great to be here with you guys. I appreciate the opportunity to share. For those of you that listen to my intro, I promise I'm not that scattered. I just think of myself as like a serial dabbler. I have a lot of things that I like to do, and so that's what works good for my mind. Not everybody would choose the same path as me, and that's completely okay as well. In terms of working as a technician, I did that prior to and during veterinary school, and I was sort of sharing that my experience in vet school is probably similar to many of you, that it's a lot of knowledge coming at you, and it sometimes can feel, or at least for me, it sometimes felt I couldn't realize what the real world application was, especially in that first and second year. I think school got easier for me as it went on, but that early time, you're memorizing bumps on bones and you're memorizing insertions of muscles. Like, I know all the things you guys are going through, and it's like, what is the point of all this is kind of how it feels. And so for me, still working during that was important to sort of keep me connected to the profession, keep me thinking about cases. Like, that is just sort of what cemented it for me. Some people can just memorize all those things. I needed to try to put it together in a story. And so the way I sort of approached school, and I don't know that I logically thought about this, but this is how it worked out, is that I, went to school Monday through Friday. Monday through Fridays were my study times, and then I would give myself weekends off, which I typically worked. And so I would either do an overnight shift or I would work a Saturday and part of a Sunday, and that would get me back, but those would be no study days, right? So work was kind of a break from school, and school was kind of a break from work. You'll probably see in my life that there are these places that I try to do a few things that sort of feed different parts of my kind of mind and body. And I think school was just another example of that for me. So I worked as a licensed veterinary technician. I worked at a mixed animal practice. I worked small animal. I worked emergency, and I worked with a surgeon. And I think working emergency and working with a surgeon were probably the primary things that I loved as a technician in terms of doing the highest level order of different techniques and things of that nature. But it's not for everyone. And sometimes I feel like I've abandoned my technician colleagues, having, gone to the dark side of veterinary school. But I also think that, everybody has to think what their path is, and this just happens to be mine, maybe different than others, but I'm happy with where I'm at.
Yeah, I know we got a ton of questions when we were APVMA officers in that Facebook group. Like, do I work during school? Like, is it worth it? Is it worth the money? How do I make money? And I don't think it's necessarily about the money. Like you said, you can get a lot out of the educational and fill your cup kind of self-care benefits. It's fun to get back into the real life stuff after sitting in a book or a computer all day.
100%. Yeah, and the balance is like I was very, very minimally involved in clubs in school, right? So some people really put their energy into being involved in the student AVMA or being involved in surgery club or whatever that is for you. There's like 40 different clubs at any campus right now. And I was a member of like one or two. So like that was the thing that I didn't take as much advantage of, because I was putting my time and energy elsewhere. You can't do it all. None of us can.
Definitely. Speaking of which, I loved how you said you were a dabbler. When everyone always asks the main question when you tell them you're a veterinary student, are you going to do large, small, exotics? What are you going to do? And my answer has always been, well, I like everything. And then they look at me like I'm naive. I'm like, no, I'm just open-minded. So what would you have in response to that when people are like, call you a dabbler?
I mean, I still get that question, like when somebody says, well, what do you do for a living? I'm like, well, I have what I think we now politely call a portfolio career. Like, I do some things in the profession and for myself that I never saw anybody else do the things that I do, at least in the kind of capacities that I do. but they, again, are appropriate for me and kind of feed my energy. But I think the question of like, it's no different than when you're asking a little kid, like, what are you going to be when you grow up? Like, nobody knows. Maybe you pick something, maybe you say something. This is a career and this is a profession where we really are like a Swiss Army knife, right? There's like a million things you could do with a veterinary degree. And so I don't think you have to box yourself into clinical medicine. It's what I do and what I enjoy, but it's not only what I do. And yes, if you're really thinking of, I want to be board certified or I want to move on to that next thing, then that might be something more for you to think about niching down. But I think a lot of people have the experience of going high school, undergrad, vet school, right? I know a lot of people now, their first job is as a veterinarian. If you don't know yet even what that first job is going to be like and feel like, why would you then put yourself down the path of, well, I need to be a cardiologist in only exotics, right? Really niche, and maybe that's perfect for someone. But it's also okay to say, we're okay to be a generalist and think about this. Like you could come back and do a residency later. You could find yourself doing a multitude of things like I do. I just think you have to find what matters and what feeds your energy. And trying stuff out while you're in school is a great opportunity because you're going to find things that you love and you're going to find things that you're like, nope, never want to do that again. And that is just as valuable as learning the thing that like feeds you and you're like, yes, I want to see that again. Some people never want to see another trauma. I have friends that like never want to do surgery and I'm like, bring it all to me. And so you can find those things. But I think if you really only think about position X or position Y, it makes it harder to be open to the breadth of opportunity that's out there. So think of vet school as a time to dabble as well. And you are in a safe place to do that. No one in your university, no faculty member, no resident is going to set you up for a situation where you would be in over your head or harming an animal. So now is the time to learn, and no one wants to make a mistake. But trust me when I say that they're not going to let you make mistakes that would be ultimately detrimental to that patient. You're in a safe place to mess up right now. That sounds weird, but it's totally true.
Yeah, I think that's a perfect way to put it. I've been using my externships and, my summer off to book in, like I'm externing with somebody who specializes in dentistry but also runs a GP. Like I want to experience it all. And if at the end I decide to go from current interest, it's okay to change your interest. Like you don't have to go in and say, I am dead set on, right now for me that's rural mixed animal GP. Cool. Because like Gretel said, we're very like-minded. I want to see everything. One of my favorite Gretel quotes is like, I never want to turn an animal away.
Yeah.
To the detriment of my own sleep. Like, I just want to do everything. So whether it's Therio, somebody needs help coming in, and maybe I'm checking cows, and then 2 minutes later, I'm working on, like, a fracture or something like I just think it's super cool. I think there's so many things, and I have a hard time choosing, so that's part of why I want to go into rural mixed animal, because if you're the only vet in the area, guess what? You get to do all the fun things, even though it's hard.
And I don't know if you know this or not, but my first few years out of school, that's actually what I did. I worked in a mixed animal, reasonably rural practice, and we had 2 locations, 7 full-time doctors at that point, and not all of our doctors did the mixed animal component. So I would spend about half of my day in the truck and about half of my day in the hospital, and that was great. Like ultimately, the way the world works, like things have changed in terms of what I do now for practice. But I really was feeling the similar. Like I want to kind of see it, experience it, touch it, feel it, even though I had that experience of working in practices for a decade or more. It's still different being the one that is the decision maker at the end of the day. The minute you graduate, you are the leader in the room, period. Like it's a little overwhelming. And I can tell you, as someone who worked in the same practice as a technician that I worked in as a doctor, it is a fascinating process for your mind to have to go through of like, oh yeah, now it's kind of on me and I'm going to have people to collaborate, but ultimately I got to be the one putting the big kid pants on and making the big choices.
Such a transition I love how you were in the same practice. I kind of have like the same thing going on. I'm like their fake retirement plan.
You might be their real retirement plan.
Their real retirement
Yeah.
plan?
Yeah.
So
Get that in writing now.
Exactly. Get it in writing. So they've known me since I was in undergrad and like some of them since I was a kid. And so I'm like, wow, this is going to be like a change. But I also know that they've seen me like do a horrible job alphabetizing cards, but I can do physics. They've seen me at my best and my worst, so I'm grateful for the partnership, but I would love to hear more about that change and also more about that change after you got your master's in public health and more about your leadership training. Like, how did you change over the course of your profession?
Yeah, I think it's a great question. And I think that part of my transition to working at that same practice, because when I was getting ready to graduate, there were other opportunities. And, you're sort of thinking, what's this going to be? And trust me, when there was some pushback on, like, you're going to the same practice where you've been. And it wasn't the place I'd been my whole career as a technician. But, the good and the bad is, like, you know what you're getting into, but, like, you know what you're getting into, right? And so I actually really wanted to go into that with a different sort of way of thinking and way of behaving. And I'll liken it to, I still sometimes will say, I'm a really darn good technician. I think I'm an okay doctor. And so I didn't want to fall back to only doing technician duties, but I also didn't want to micromanage my team either, right? Like, I'm not here to say, you have to do this way. You might have a different way that works better for you. So how I approached it is a little bit happenstance, but I think ultimately worked out well. So there is a program called the Veterinary Leadership Experience, the VLE, and it is about a week-long experiential learning. You guys have recently had like your vet school onboarding days, and so you've kind of gone through the like team building and all that within your classmate. So think of this as kind of a version of that is different individuals from each veterinary school across the country. And so every school chooses different. At Ohio State, we had to write a letter and explain why you wanted to be a participant. Most people go between first and second year or second and third year. I actually went my clinical year, my fourth year. And so in my letter that I wrote, and I've gone back and looked at it a bunch of times, I wrote in there, what I really want help with, and I want to come out of this with, is how to help myself going back into the same practice where they already know me. And I have an identity there as the technician. And how do I transition myself to showing up differently as Dr. Jen instead of Technician Jen? And so for whatever reason, I got chosen, got selected, and that experience, I've met a lot of people and I learned a lot of skills and I've gone back many, many times. But that, I think, was really the big piece for me that helped me to transition, was thinking about how do I want to behave differently, because you have to manage your time differently. I don't get the opportunity now to go and snuggle the pets as much and to go walk the dog, right? Like, I might do those things, but most of the time I need to be going from room to room or researching a case or following up on blood work. Those are different things than what you're doing as a technician. And so all that to say, VLE and writing that letter, I think helped me on that path to like, what could leadership be? And I mentioned I wasn't involved in a lot of clubs in school. That also was probably like the early seed of me thinking about getting more involved in organized medicine without me truly knowing it at that point. But that, I think, was a really good push and a skill development for me that helped me to kind of make that kind of move from technician into doctor land.
Was leadership, so I'm AVMA President-Elect for Mizzou, and so I'll be at VLE. I'm very
Congrats.
excited for it. Thank you. Was leadership, like, did you want to make change in yourself first or change in the community? How did that change for your mindset going on as well?
So I think all leadership is self-leadership is how I think about this. So like my roles right now that I have within the AVMA and within auto and within veterinarian coaching and all the places that I show up in relief work, all of those are still about me leading myself and showing up in a certain way. And so I think that, I want to think about the context that I'm walking into differently, right? When I'm walking into an AVMA board meeting, I need to be thinking about the membership and the direction of the profession. And that's a really big picture strategic thing to think about. We have over 110,000 members. I'm one of 16 people representing a lot of people, in this profession. When I'm in the boardroom at Auto, I am also, leading in a way, but it is different, right? I'm thinking about a business side of things. I'm thinking about helping practices, helping them with their communications, like just doing different things. But I think ultimately, I just wanted to know more about me, and that led me to see and learn things. And specifically, the next thing I did after VLE was started working in my practice, and we had a regional, like a local veterinary medical association. So like here in Northern Kentucky, we have our large state organization, and then we have these kind of community-sized ones. And I went to one of those, and there was a position open for kind of the communicator between our local group and the state group. And I applied for it. And I don't really know what possessed me, quite honestly. But I applied for it, and it was the first time, I think, ever in the 30, 40 years that it had been a contested election, meaning there was more than one person running. And somehow I ended up in that role. And that put me on the path to like learning more about my state association. While I was on my state, I learned about some things at AVMA, and I volunteered with something at AVMA. And here comes my serial dabbler again, right? I love knowing some of what's happening at the local level in my state, but also being able to zoom out and see some of those big picture things. So I don't know if that helps to think about, or at least to see it from my point of view of what that looked like for me.
Completely. That is very helpful. So I think Michaela and I had a similar experience. We were both very involved with our pre-vet clubs. So I had a bunch of jobs in that, like programs, APVMA rep, then president, and then big APVMA president, and then Michaelan did a ton of jobs too. So transitioning from local level to national level was a big jump. And
Yeah.
I think my favorite thing was meeting people from all over the country and comparing how vet med translates somewhere else. What's been the greatest part about meeting people from all over the country?
Yeah, I think it's a great question. And again, this is a skill, that I probably knew, but was harnessed more and implanted more through things like VLE and being part of like the Future Leaders program that AVMA has, which is like a personal leadership development program. And the idea is like, no one wants to network, right? Like it sounds very awkward. Everybody feels weird about doing it. But at the end of the day, I had someone describe it recently as don't think about it as going in there to like garden and like pull flowers that you're going to take home with you. Think about it as like planting seeds. So you're going in there and you're meeting a lot of people, and some of those are going to develop into a more fruitful relationship. Some will fall flat, and that's okay, and that's normal. But at the end of the day, what are you sacrificing to have that introduction and walk up to somebody and say, "Hi, I'm Jen. I'm from wherever, and tell me a little bit about you," right? Like you might be in an awkward conversation for 1 to 3 minutes, but you will move on and, live and be fine from that. What I have found to be the truth of that, though, is now, I literally am connected with people who are all across the world, but particularly across North America, who I could reach out to. I have friends that are board certified radiologists and people that are theriogenologists and people that work on zoo animals and do different things than what I do. But I often say, like, I'm not necessarily the person that's going to know all the answers to the things, but I have enough connections that I will often be the person that's like, Gretel, Michaelan, you should meet this person because they have similar interests to you and you guys would really hit it off. That really gives me a lot of energy of like knowing, again, I don't need to be in the weeds of it because it might not be what is important to me, but just knowing that I can help to solidify that relationship is a great thing. And to then see that down the road, I think is really cool. So networking, yeah, it sounds lame and it is a little bit lame and it always feels a little bit awkward. Like I have my go-to questions and you should, like I would recommend get like 1 or 2 go-to questions of like, how do you ice break? And then you ultimately will find that you're going to develop these relationships and learn things about people and their journey that are going to help you down the road that you never even realized were going to be part of your journey.
You mentioned, we've talked a lot about the transition from veterinary technician to veterinarian. One thing that's always kind of perplexed me is, I think part of it, it's for a lot of reasons, but I think part of it is that we work such high stress jobs, especially the technicians. But what interests me a lot is, why do you think, or also how do we mitigate toxic cultures? Because vet med technicians especially have this reputation to be kind of toxic and kind of catty with each other. How do we mitigate that as veterinarians, especially with the added context of, oh, I used to be in that spot? Because I don't know, I've experienced some interesting work cultures, so I was wondering if you had any advice on that.
I think a couple things I would say, and it's a really great question. Like I think when it comes to our technicians, we could go down a whole rabbit hole there, and maybe we'll circle back to talk about how we keep our technicians engaged and give them a growth opportunity and all of those things. And I think that not every work culture is going to be the same for every single person. I try to, and I feel like most of the time I'm successful with assuming good intent, right? Like assuming that that person is coming into this with good intent. Whatever they are stressing about, even if I think it's about me, it's probably not about me. That like we all think that we're the center of everyone else's thoughts, and probably very likely we are not the center of anyone else's thoughts, which sounds horrible to say. Now, the other part of that is assuming good intent, but also having boundaries, right? Like that sounds simple, but it is very hard to do. We are people who want to say yes to everything, just to your point. Like, I'll sacrifice sleep to see another patient. There are phases in your life where I think that's going to happen. Right now, you are probably not really knowing what's happening in the land of movies and TV and media because you are in the thick of vet school, right? And everything is kind of focused on that. When you've graduated, you will, and even during school, you can probably open that, compass up a little bit and look at some other things. And what you'll see is that there's more beyond just what's happening in our bubble. And I know that sounds like, again, so obvious, but at the end of the day, I think we need to be able to say, when I'm tired, are you hungry? Are you angry? Are you sleepy? Is something going on that you need to like assess your body? And is that leading to some of that toxic culture? Everyone is entitled to a bad day. Everyone is entitled to have a bad case. I don't think anybody is entitled to be abusive to anyone or to a patient. Those are very clear boundaries for me, but also on the whole, and this is some of the stuff we talk about with auto too, is like, I want folks to be able to get out of work on time so they can go home with their families, right? It's not that we don't want to enjoy the teams we work with, but at the end of the day, this is a job that we're going to. And this should not be, and I hate shoulding on people, but this should not be the thing that we're doing 24/7, 365, right? There are times when we're going to work more. If you're building a practice, if you are in a residency, if you're XYZ, yes, you're probably spending a little bit more time then. But if you have a brand new baby at home, you're probably investing a lot of time there too. And so thinking about what sort of phase of life you're in and what boundaries you can put around that, I think those are easy for us to think about, but they are hard to actually implement. So, I think finding what is that for you? I am a 7.5 to 8 hour a night sleep person. I wish I were a 6-hour person. I am not. And so I know I need that time. And I can survive a couple of days under that. But boy, that third day, I start to get a little bit prickly. So my boundary is I need to get sleep. It is important for me to show up the next day that I have that. Maybe for you, that is I need to get outside of the building during a lunch break. Maybe that is, again, I shared with you when I was working during school, I'm going to go to work because that was a break from school. And school was a break from work, right? Like they were both a little bit of that for me. I don't know if I've totally answered your question, but I think for me it is like there are truly ugly places, and don't put yourself in a situation that is unsafe and unhealthy. And I would overall assume good intent because I think most people really are doing the best they can. And I would also say we also need to take our own personal inventory of have we put that boundary? Again, are we hungry? Are we angry? Are we thirsty? Are we tired? Assess those things before you kind of go down the path of getting more angry or upset.
Yeah, I think that's interesting. Boundaries are very important. I really struggle with all of that because I'm so non-confrontational. I very much, unfortunately, foresee that being a problem with me as a vet, is knowing that, like, I'm supposed to be in charge of this situation. How do I, like, fix this? Like,
Yes.
I hate when people fight, but also I don't, keep me out of it. But I know that eventually there will be times that you may have to step in if it comes to that. I think something that's important to me also, not to everybody, but to me is, I've heard a lot of people say, well, in real practice, the techs are doing this. That's true, but I also don't believe in shutting myself off to helping out. So I think it's important to me to keep yourself grounded and not get that kind of God complex that some, not all people get. It's not always on purpose. Some people genuinely kind of forget that, everybody's on the same level to some degree. You're all humans. Like, you're all the same level human. You just have a hierarchy within work, if that makes sense. So I think, not belittling other people and saying, that's a tech job. I'm above that. I'm a doctor. I don't have to do that. That's important to me. I think that has helped me as somebody who is in any organization, whether it was in my production animal medicine. One of the most meaningful things that my bosses would do is, I know that there was a holiday and we were all college students. We all lived out of state. We went home. He covered the weekend, even though he had absolutely no requirement to do so. Like, it's just the little things like that. He only had to come in 1 hour that weekend, but it genuinely made a lot of our Christmases happen.
Yeah, I think it's great to think about. And like, again, we all struggle a little bit with boundaries. I think practice is now like, if you're going to go into clinical practice, and even if you're in, if you're in research or you're in industry or wherever you might end up, in this, I think I called it a Swiss Army knife of vet med, right? The multi-tool. What are those, what's the brand of that multi-tool that everybody uses? You know what I'm talking about? We have an answer in front of us. Like, very few of us are working in one doctor practices anymore. Most of us are working in multi-doctor practices, and or even if you're in a small practice, you have a team. And this is the place where I think as veterinarians, we don't have to do it all. You can choose, do I want to see every species or not? Do I want to see all those cases at the end of the day or not? And when you have those cases in, nothing makes me feel better than to empower the team to really take that on. So when Mrs. Jones comes to me and says, Dr. Jen, help me understand the nutrition or the behavior or whatever for my new puppy, I'm going to say, you know what? I'm happy to go over that, but I would really love for my technician, XYZ's person's name, to come in and chat with you about this, because they do an excellent job and they will probably answer every single one of your questions better than I might be able to, because this is the thing they love to talk about, or they have a puppy or something like that. So we're all kind of aligned in what we're saying, but we are lifting up those assistants and veterinary technicians and our practice managers and our front desk team to empower them to have those conversations. For us as veterinarians, that also means we need to let go a little bit, right? Like, it can be really easy for us to want to do all the things, but lessen up. And I think that actually can help all of us to see I think vet med is a team-based sport, right? We all need to be getting involved. Now, there are certain things legally that each person can't do. That's a whole different can of worms, but there are plenty of people who can communicate with a client about an appointment or an email or whatever the thing might be. And so I would encourage the future veterinarians out there that are listening to this to lean on your team, because they're really going to help you much more than you think.
It's amazing. Speaking of leaning on your team, I feel like veterinary school can be very solitary. It's dependent on you. I mean, sure, you have your friends who are trying to get you through it, but I have met with a lot of students, and including myself too. This is some of the first time in your life where you're truly being met with failure, and the stakes are higher, and your brain has never worked to this capacity before. At least I have met my maximum brain capacity and have learned how many times I need to see 500 pieces of information in order to remember it.
Yes. Yes.
I would love to hear about how you can tell people about how to not compare yourself to others and what brings you back to that joy in saying I can do this, I can manage this.
Yeah, I know that school, and I mean, I think I was there too, we all feel like there's just so much information coming at us, and it's been likened to the fire hose coming at you at full power, or you guys have probably heard that, right? And I do think that can be the case, but I also think it is, what is the end point of the school, right? Is it to be the perfect student, or is it to learn and pass the classes? Those are slightly different lenses that you could look through that studying through. And there are going to be times, to your point, Gretel, where you're going to have some folks that are better at understanding the physiology and some that are better at the anatomy. And so I think you probably learn more by teaching someone else. And so when you're in those study groups, it's not so much about somebody asking the question that you know the answer to. I would pay attention to the thing you don't understand, and that's the one to kind of push on and to get someone else to explain it to you in maybe a different way. And they might have a mnemonic or a visual or something that you're like, oh, brilliant, I never thought of it that way. And so now we're all kind of gaining from each other. We all are pretty driven. We all have pretty good grades to get into vet school. And the minute you get in that class, the school wants you to graduate. Your classmates are all there to graduate with you. This should not be about competing. This should really be about collaborating with each other. And that's how we work in practice. And so I think this is, again, a great time to practice that. I mentioned earlier, I think failure is a darn good thing. It's feedback, right? Much rather you have a miss now than have a miss in 3 or 5 years when there's a life that could be really impacted by that. And we are all going to mess up. There's no doubt. I've probably made 15 mistakes today, right? And it is sort of thinking about, how do I own up to that? Do I share with someone? Is there a safe space for you to have that conversation? And realizing, at least from my point of view, failure is not a reflection of you as a human, it's feedback, right? It doesn't mean you're a bad person. It means you need to learn that thing differently. It means you need to like maybe focus on something else. But if you never go back to it, then you may never be able to overcome it. So I think looking at failure as just another piece of data is hard. Don't get me wrong. No one likes that feeling. None of us like that feeling, me included. But I think it is an opportunity to continue to learn. I mean, I'm still in the roles I'm in now. I'm doing different things. And so I'm pushing myself a little bit on things as well. And I'm like, oh, I could have done that better. But I can't just hang on that, right? Like you've just got to keep moving a little bit. So I don't know if that helps at least think about failure as not this horrible thing, but as a positive feedback mechanism.
Oh, totally. It's going from like the A mindset to the passing mindset. Right, Michaelan?
Yes, C's get degrees. Some people hate that phrase, but like that is true. Now, you might not get into vet school with all straight C's, but once you're in vet school, C's get degrees. So
C's,
I think
I know two other versions of that. Do you know these other ones? So C's get degrees. C equals DVM or VMD if you're in Penn.
okay, I have heard that one.
Yes, and there's one school that their Basil, you'll love this. It's a 225 to stay alive because that's their GPA. So, again, right? It's like I just
awesome.
need to. You just gotta stay in. Nobody cares if you're first or last. At the end of the day, when you graduate, they still call you doctor.
Yeah, I think it's really, 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 really important to accept failure and to talk about failure. It's something that has been very frustrating to me since coming to vet school. There's a lot of, not everybody, but there are a lot of people who refuse to admit to other people, I did bad on that test. Like, I am very open about, hey, I got into vet school, low GPA. That's important to me. It's important for people to know that you can get in with under a 3.97. It happens. People just don't talk about it enough. And then also, it is okay to make a C on a vet school test. Like,
It's
don't
great
have to pretend.
make a C.
It frustrates me. Yeah, it frustrates me.
Yeah.
People kind of, I think it's more of a within themselves thing. It's not like, oh, well, I'm better than you. I don't want to admit that I did worse than you or that I did bad. It's kind of like, I don't want to admit to myself that I did bad. But I'm very open when I say, I did bad on that test. And some people are just like, I'm like, I know you did bad.
I was thinking about you mentioning like the mean girls or I'm using a language, but like people who are being a little ugly at practice. And, there are people that have that energy at school sometimes too. And sometimes it's like, I think that is way less about me than it is about them. And so I always have to tell myself, like, I don't know what's going on with them. Maybe this is an overcompensation for a lack of confidence. I want to help that person, but it's not my job to totally fix your attitude, but I also don't need to put myself into that attitude every single day either, right? Like, I can choose, again, where that boundary might be.
Yeah, I just think it's important. Like, I've faced a lot of this. Everybody is still in this. I understand the mentality in undergrad. Like, it is, by definition, a competition to get into vet school. I understand. You're kind of in that, like, survival mindset, like, survival of the fittest. I have to get in, which means what I do indirectly affects my chances of getting into vet school because you did better than me, if that makes sense. But once you're in vet school, I've never understood the continuation of, well, if I get an A, you should do worse because that'll make me better off in the end. I've been preaching this all semester to some of my friends. I'm like, if every single person in this room gets an A, there's no possible consequence other than that your next test might be a little bit harder. Right. Because we obviously did so well. So whether that's
somebody's going to say, how did everybody get the answers to this before? Because it's just not like that is not a normal distribution. This is not how this should go.
Like not everyone gets A's.
People are kind of stingy with their study resources or they're stingy with their study group. And I'm like, if you would just let people in, all it's going to do is good things. It's going to foster community within the 200 vet students that LSU has. Like, it's not a prevalent problem, but it is a problem that frustrates me a little because I'm like, it would benefit everybody if all of us were a little bit more open about our experiences, our failures, whether it's in the past. Like, one time I let a bull out at a vet clinic I was working at across the street. That sucked. But it happened and I'm still going to be a doctor. What do you call a doctor that gets C's? A doctor. Like, I don't know. Let me get off my soapbox. But that thing, that
I feel it
kind of gets me heated because I'm like, it's okay to do bad. Like, just accept that. It's okay.
It's probably even good to do bad. Like, again, now is the safe time to do that. And your first year and two out, like, you're going to make so many decisions and then you're going to question them. And there are people that will just live in that cycle of repetition and, ultimately None of us are perfect humans, and they call it practice for a reason. This is practice. This isn't like we have the exact answer to every single thing. And even if we have the tools and the diagnostics to get us that exact answer, the client may not agree to it. And so you might still have to make some empirical decisions, and you probably will a lot. And so yes, it's good to learn the processes they're teaching you in school, but I suspect that many of you are never going to have a case that is exactly like something that you're learning about right now in vet school.
I don't know. We had an interesting, I don't know if other schools do it, but for LSU, the past 2 days, we had problem-based learning where you take 2 days, you work in a group of 6, and you solve a case from start to finish. And it was very, very long and difficult, like 8 to 5 kind of day. And it was a male iguana, which we've learned nothing about. So it's genuinely problem-based learning. Like, we had no idea anything, at least my group, about reptiles in general. We haven't gotten there. And so, he comes in, he has XYZ symptoms, and we're like, oh, it's actually a gravid female. So that means carrying eggs. And just stuff like that, I'm like, just solving that as a case without knowing anything, I feel like that's kind of going into the practice. That's kind of the point. But when you get to practice, you might face cases where you're like, I have literally no idea. Like, how do I learn and how do I gain something out of this and help the animal? So it's just an interesting
tip. When you get those cases that you're like, no clue, ask your technicians. Because they probably
I've
know.
had technicians in techs that know way more than
100%.
nothing for the doctor, but everybody has their area of expertise. There is multiple techs that might know everything about reptiles, and they do reptile as a hobby, like that's their thing. And then a doctor with a degree might be like, what did you just say? Can you inform me? Like, that's how I am. If you know something that I don't, please share it. Like, I'm not going to hate. I'm not going to say, yes, I knew that. I didn't know that. That's another thing. It's okay to say you don't know. People are unwilling to say, I don't know. I think it's very important. I did that during one of my vet school interviews for university. I won't say that, sorry.
No. For some random place that's not LSU.
For some random I don't know who asked me this question, but they asked me a clinical question, and I worked necropsy. I have not worked with live animals in a clinic setting. I did production animal, so not in a small animal clinic since I was 14. So I had absolutely no idea. And they said, what is this, clinical scenario? And I was like, 100% being honest and transparent. I don't know. And I got in because I was honest. I didn't just, pull something out of thin air and say, oh, that actually means, the respiratory rate, heart rate, 84, 2008. I didn't know.
2008, that's my favorite number today.
I don't know, I didn't throw something out there because I wasn't embarrassed to say, I don't know, and they were very accepting. They were like, we recognize that, you worked with dead animals for the past 2-3 years, so you probably don't know this question, but give us your best answer. And I was like, I'm so serious, I don't know. I have absolutely no idea. No idea. So,
and by the way, this is part of what I want to go to vet school for, is to learn the answer of some of these things.
No, exactly. I just thought it was very interesting. I thought I did well in the entire interview other than that, and I was like, they can't hold that against me. I literally haven't worked with live animals. And then, again, I got in. It is totally okay. People do it all the time. They're like, oh, yeah, da-da-da-da-da. I'm like, you just made that up. I know you made that up. I know people oh, yeah, this about football. And I'm like, you made that up. You didn't know how many yards that person ran 3 years ago. You liar.
I wouldn't know any of that. I know nothing sports, but I think you have to be, so 2 things. I think your clients will love and trust you more if you are just honest with them, right? And they're going to know. Sometimes I think we have a good sense of when someone is being dishonest or disingenuine, and we don't always know why, right? We can't always put our fingers on it, but we know that something is off. And no truer read of us is it than our patients, right? They can pick up the energies on us from a million miles away, and they don't need to hear the words out of our mouth. But I think if you get into that habit, or it just can go down a path. It's way, way easier to say, I don't know, or you know what, I know a little bit about that. Let me go look this up for you. Nobody needs that answer right this second, or rarely do you need it right this second. So buy yourself a little bit of time to go figure it out and come back. They will thank you more for it, no doubt. And you'll learn more.
I genuinely, if me personally, if a client asked me a question I didn't know, I'd be like, you know what, I don't know, let me go research, let me consult with hopefully there's another doctor, and it's not let me go Google that. But, let me go consult with my senior doctor, let me go consult, something like that where I sound a little bit professional, but I really have absolutely no idea what they're talking about. Sometimes I've experienced that in vet school where people are like, hey, do you know this thing from anatomy? And I'm like, let me open a textbook. I don't know. Like, it's okay to say you don't know. We don't know everything. That's why we're in school. So,
We can't. And even once you're out of school, like it's literally impossible to know it. There's so much knowledge. And so, the big secret I think of veterinary school is like, yes, the information you're learning matters, but it's really more about the process of working through the problem, solving the problem. You're basically a detective. How do I get through this mystery? Those are the skills that are so transferable, and that's what makes us as veterinarians so flexible to do so many other things. Yes, a lot of us are going to go into clinical medicine, but there are so many skills you can do with those abilities to look, analyze, observe, and make a plan. Like that is a skill set you could transfer across many, many professions. And so don't discount, the processes that you're learning more than just the data itself.
That's very helpful because I feel like it's a lot of information, and then your
It
brain
is.
is like, what did I do 2 weeks ago? And you're like, oh, but then you pick it back up. Speaking
Yep.
of which, we were talking about failure and being transparent. You talked about leading with integrity, humility, and heart. One of my favorite Brene Brown TED Talk videos is about vulnerable people are the happiest people. And that actually changed like the course of my life. Started going for everything and being very transparent. Could you talk more about those values?
Yeah, it's really good. Like, so I'm a really awful person at not telling a truth, and so I can't play poker. Like people, you could take my money all day long from me. You can read me from across the room, and so I am the same person. I mean, I might use slightly more or less different language depending on what room I'm in, but I am the same person here as I am in the surgery room as I am in the boardroom. That is what works for me, is that I might say things or strategize a little bit different way, but I need to ultimately be me. And so I just think I want to, like, I have these sort of three like guiding principles, right? Like you all have your sort of core values. Mine are honesty, humility, and humor. It's important to me that there's some laughter in my day. It's important to me to have a little bit of joy. And that might be something as silly as like a pun. I love a literal joke. Give me a mom or a dad joke. I'm here for it all day. It might be that I need to be honest with myself. Again, have I had enough sleep today? Have I had enough water today? Have I gotten out and moved my body? Or do I need to just say no to one more person? Some other request comes in and I have to say, I would love to do this for you. And if I'm going to do this, then somebody else need to take this on for me. And so that's okay, right? Like just being honest that like I'm at this point, I can't quite take more on. And then I think the idea of being humble, like to me, what that means is I hope that everyone I meet will encounter me as a person, not as a doctor, not as a degree. I really want people to know me as Jen. And it's fine that if I'm introduced as Dr. Jen, Dr. Quammen, all those things, yes, I've earned those degrees, I've earned that title. But what matters to me more is connecting with that human. And so whether that is somebody in the exam room, whether it's somebody when I'm out like getting my car worked on, like I still want to be able to just have a human to human conversation. That I think brings more richness to my life and just again makes my relationships a little bit more hopefully fruitful and hopefully longer meaning. I don't know if that exactly sort of answers where you go, but I think that gets me to like, for me, the vulnerability is this is it. I mean, this is what you see, flaws and all, there's plenty of them. And flaws and all, I'm still doing these things and I'm doing things that if you'd have asked me 5 or 10 years ago, I wouldn't have thought, oh yeah, I'm for sure going to do that. So, I'm doing some things that are different and I'm happy about it. And I could be making a total mistake and we'll find out in the future. But for now, I feel pretty good about where I'm at day to day.
yeah, and I think kind of switching gears a little bit, we talked a lot about transitioning from technician to vet. I don't know why I just thought of it, but I saw a post recently that says, has anybody dropped out of vet school to become a tech again? And I thought that was really interesting. Do you have any thoughts about that? Like,
Fascinating. It's really fascinating. Like I think so there's two arguments of me. One argument is like we need a lot of really good technicians in this world, period. And we need assistants as well, but like we do need more people that are going in and staying in the technician profession. Like right now we know that folks don't stay in that career field for a really long time. I think numbers wise, if you look at the sort of numbers of like how many technicians per doctor does it take to be really efficient in clinical practice, we know that number is more than 1 to 1. It's more like 2.5 to 1. Depends if you're in small animal, large animal, there's some variation there. But let's even say it's 2 technicians per veterinarian. That means that we need to be producing maybe twice as many technicians or keeping twice as many of those people in the field as there are veterinarians. And so if you get into vet school and you're a semester in or a year in and you're like, whoa, maybe this is not the thing that I want. Maybe like me, you missed handling those animals and talking to those clients and doing all those treatments. You can still do that thing. And that's not a down step in my mind. I think that is acknowledging what really matters for you. And there are lots of great technicians out there, and I think we need more and more of them. So I am all here for getting us more technicians, for our technicians thinking about what they do. And I don't think that the path to becoming a veterinarian is right for everyone. Some people might get in. Again, I mentioned earlier, I think more and more commonly people are going direct. Well, I think this has always been going on, but since it's different than my experience, undergrad, high school, undergrad, vet school, right? And so you've not always had that life experience. And so you might get into a year of vet school or towards the end of undergrad and think, I think I want to do that, but I don't know. Go and get a technician degree. It's less money. You're going to still be in the practice, and maybe you'll decide that that's the thing you really love and you don't want to commit to a longer term career. Why not? There's not a lot of harm in that. There's no race. There's no race to get this done today.
Yeah, I think a lot of techs think that, the answer is always, well, eventually I should go to vet school, right? I don't think that's always true. I think some people are genuinely happier, better at, and very, very needed good techs, like you were saying. So the kind of mentality of, well, I'm such a good tech, that means I have to go to vet school, or people are telling me I have to go to vet school. I don't think that's true. I think a lot of people should stay techs for, their happiness. It is more fulfilling for some people than people wanting to do the doctor's side of it, if you will, doing the hands-on part. I think it would be a lot easier to retain if we could pay more. The whole field is arguably underpaid, overworked kind of thing. That's a very, very long-term problem. That's not something we're going to solve anytime soon, or really at any single clinic, to my knowledge. But I think we talked a little bit maybe about veterinary tech retention. And I think one thing that I've seen that I would agree with from my experiences throughout all the jobs that I've had, whether it was waitressing and we did, some really fun courses on like wine tasting or stuff like that, I think it's really important to emphasize the continuing education, whether the clinic is paying for it. There's a lot of free opportunities that I get sent as a vet student. Yeah, do you have any other advice for maybe veterinarians or vet techs and the retention aspect of it?
Yeah, I think as a veterinary technician, there's lots of opportunities out there for you. So you could, again, there are some states that don't actually credential or like license or certify technicians. Most of our states in the US and Puerto Rico and DC do, but not all of them. And so I think there is value in going to school and getting that degree as a technician. You can still do a ton with that. In some states, you might be able to own a practice. If you could be a business owner and own and tell veterinarians what to do. Wouldn't that be great? So you could hire your own team of veterinarians. Like that might be something you consider doing. Maybe you want to teach future technicians. There's an entire organization that is dedicated to educators of technicians. Technicians and technologists, slightly different. We could get into that. There are also things that you could do in terms of like niching what you do as a technician. So for example, you might really love equine practice. And so there is an organization that supports equine veterinary technicians. So that might be the thing you want to do. You might want to go into lab animal medicine. Maybe you want to go into a specialty. There are, I think the number, I can't remember if the number is 24, I'm going to mess this up, but how many different specialty credentials you can get as a veterinary technician. So there is something called a VTS, or a veterinary technician specialist, that is essentially additional training after you've gotten your technician degree that allows you to do a more like in-depth work in a certain field. So there's VTSs in anesthesia, there's VTSs in dentistry, in clinical pathology. There are all these different things that you might be doing. And by the way, as a veterinarian who's doing surgery, if I have a VTS in anesthesia, you better believe that I'm having them help me work up my plans of more critical patients and where they're going and how we kind of organize this. That way I can go in and do the work, and then they can help with the recovery as well. So I don't think at all that being a technician is a bad thing or a down step. Like, we work in a different place in the profession, and we need all of us there. And I think as technicians, you need to nudge your doctors a little of like, hey, can I give a go at this? Because in most situations, there is much more that technicians are able to do than what they do on the day-to-day. Some of that is on us as veterinarians too, of like, get out of the way, let them do and work at the top of their license. It's a two-way street. They got to advocate for themselves a little bit, and we also need to be cognizant of the fact that it's really easy for us to just go in and take over everything when, by the way, we don't really need to, and we could utilize them.
Yeah, and a very, very shortened definition, if you will. LVT versus RVT, like you said, it's different for every state.
Yes.
Different for every state, but as we're kind of reaching our time limit, as a brief definition, there is a difference between a technician and calling yourself a technician and an RVT versus a vet assistant versus, maybe you're volunteering just because you volunteer. And I didn't know this before like 3 months ago, so it's okay if you don't know it and you're listening to it. But
totally.
volunteering.
So there are veterinary assistants. Yeah, exactly. So there are veterinary assistants. It's all good. VAs or vet assistants can be certified, but usually those are more on-the-job trained folks, generally speaking. Veterinary technicians or veterinary technologists are usually either a 2-year or a 4-year degree. The technologists usually do a 4-year degree, and that's the degree that they've earned. But then being an LVT, a licensed veterinary technician, a registered veterinary technician, or a certified RVT, LVT, CVT, that is up to your jurisdiction. So in each state, we might call it something different. In Kentucky, we call it an LVT. The kind of umbrella term that we're using now is credentialed technician. So credentialed is kind of the umbrella that goes over LVT, RVT, CVT. So realize that those folks are, not only have they gone to school, they've passed a national exam in most cases, and they are sort of subject to different fields of attention from their states as well in terms of how they're practicing medicine.
Yeah, and one more note on that. Do we have an opinion on the whole vet nurse? I don't know if you've seen this, but the vet nurse terminology, are vet technicians and anybody who works in that area of vet med, should we be calling them vet nurses? I don't have an opinion on it. I was just curious if you did.
It's an interesting question, and I think it is. So it had a lot of energy a few years ago, and it's kind of backed off a little bit. Again, I think that's really language that each state would be able to say. For example, in the state of Kentucky, nursing is sort of protected as a human healthcare term, and so we couldn't use that term here. In other states, they might. And so that's really, it's more nuanced, but I think the thing that matters is title protection for those technicians. Please do not call yourself a veterinary technician if you have not gone to veterinary technician school and graduated, or you are licensed or certified or registered, whichever it is in your jurisdiction. And that's no shade to people that are on the job trained. Like, there's some really great folks there, but it is different. They've gone to school, they've earned that degree. The other thing I would add is that in terms of nursing, I think it could be helpful. You could make the argument that that's helpful for our clients to understand more. Because just as you said, you didn't know the difference between a credentialed, licensed technician, VA. Like, those are things that I don't think our staff know either. And so I think that is something that's on us a little bit to help our clients understand that there is something different than just veterinarian and everything else, right? So whatever you choose to call them, be consistent and maybe help get them out there in front of the eyes of your clientele, because that will help them develop as their own profession as well.
Yeah, I just thought it was super interesting because literally, like, when I got to Baton Rouge, I was like, what do you mean they're not all technicians? Because in my mind, it's like vet tech, volunteer. And that's all I knew. So, yeah, it's good to get that out there and educate a little bit.
Shades of gray everywhere, aren't there?
Because once I was educated on it, I was like, you are so right. You deserve so much more respect. You tell them. And then I was like, well,
my bias is showing here. My bias as a previous LVT is showing here for sure.
And as somebody who is not certified in any way, credentialed in any shape, way, form, I was just like, okay, so that falls under part of my responsibility as a vet to advocate for those that are not under me as people, but under me in the hierarchy of, the vet world.
The work life.
Especially on social media with somewhat of a platform, vet tech, RVT, vet assistant, vet volunteer are all very different, and I think that's an important point to make.
We'll just let you keep preaching on that. We'll just keep spreading the good word.
Perfect. The people need to know.
Yeah, I just was like, you deserve that. You deserve that title. You worked for that. You're right.
Yep. You got the degree. Multiple. I have one last question for us to wrap up. So, Michaelin and I talk about this a lot, but at least the reason I have said yes to larger roles is that I had a year of yes where I saw a woman doing this online, and she applied to everything that she thought she wouldn't get and that she was afraid of. So I was like, okay, cool, I'm going to try this for a year. Got the APVMA job. A lot of other traveled internationally. Michaelin also traveled internationally with APVMA. It was exhausting, but it was amazing. What advice do you have for students to go out for big roles? Like you said, you didn't know what, you didn't even imagine that you'd be doing this 5 to 10 years ago. What is your advice to them?
Yeah, I mean, I love that idea of like say yes, to things for some time bounded period. I did a series of posts a number of years ago that were like 100 days of awesome, and so every day like what was the awesome thing that was happening that day, and so similar kind of energy there. I think you just have to give it an attempt, right? And at least in my role, I'm in this little bit larger role with AVMA where I get to represent so many people, and I was a little bit, I think, the dark horse candidate when I ran. And I ran in a different way. I used a lot of socials, and that was important to me because I want people to see the process and to hear it and understand it and make this relatable and identifiable. And I think that that was me saying yes to like, I'm going to see what the world has to offer. I'm going to give it a go. And if it works out, great. And if it doesn't, I'll have a really nice year of like video sort of diary, if you will, like that I can look back on. It worked out okay for me, but it, could have gone the other way. And I think that if you want to get involved, just find the thing. Ask someone. Ask these folks. Ask someone at your school. You don't have to be the president of every club, and I actually think you probably shouldn't be the president of every club. But find something. And if that's at school, great. If it's not, if you love chess, go be on a chess competition. Go do intramurals. One of my very good friends did intramurals all through college or all through vet school. She's super competitive and physical, and that was great for her. Find that way that you can have your voice out there. I'm happy to be a resource for folks if they want to reach out to me. And I think that, no is an okay thing to hear, and you're certainly a no if you don't try it. So pick something and give it a go.
That was advice that I always gave to people in a different context, but same idea as an orientation counselor for freshmen.
Yep.
As pre-vet specific, they would be like, what do I minor in? Do I need a minor in public health, because Auburn has a great public health program. And I was like, if that is what you are passionate about, yes, it would definitely help your degree, but what does that say about you as an applicant and how unique you are in your interests versus every other pre-vet Auburn student that's doing a public health minor? Mm-hmm. So do something that interests you. If you're interested in photography, minor in photography or art or business, whatever you want. I did agribusiness because I wanted to eventually run my own practice.
Yep.
Do what you want. Follow your passions outside of vet med. You're allowed to have a life outside of vet med. But as we wrap up, would you like to plug your socials, leave some remarks, anything that you want to close off?
People can find me. I have sort of a weird last name, so I'm pretty easy to find. And full disclosure, my website is still a little bit based on campaign stuff. I'm mid-updating the copy on there, but jenquammen.com, Quammen. All the socials are on there, but in most places I'm at VetLeader Quammen, VetLeader Quammen. Otherwise, you can certainly go to the Google machine and put in Jen Quammen, and I'm sure it will find me because I have a little bit of an odd last name.
Yeah.
Super happy to connect, and I hope to see some folks at APVMA again this upcoming year. I will be there, and other ways around the world, please say hi.
Yeah, and I'm at LSU, so I'll be at APVMA Symposium. Have they released that?
Yes.
Okay.
I think so. I think I knew LSU. I think that's public information.
I was going to say, I think we announced that, but I wasn't sure. I didn't want to, leak that.
Editing room floor.
Come to LSU and see.
Registration is open soon. So.
I was going to say, that should be released, right? Okay. I'm just releasing all the vet secrets. I'm releasing interview questions. I'm releasing, symposium locations. Just text me. I know
Here's
everything.
My number.
Yeah, I'm actually leaking my address next.
And here's my password, too.
Yeah, go ahead and take it. You know what? Go ahead and hack me. It's fine. You'll probably, post something fun. I don't know. Okay, well, Gretel, do you have any other closing remarks? All right, well then, thank you for listening. Thank you for joining us today, and follow us on Instagram. It's at The Vet Files. Our website is The Vet Files Pod. We're on Spotify and YouTube, which you're already listening on. So leave us some feedback. We have some feedback forms on our website. And thank you.
All right. Thanks, everybody.